All right, we on. What's up, guys? Welcome back to another episode, and this is actually going to be our very first Q&A, questions and answer. And today, I got an honorable guest. His name is Paul.
Hello.
So a really quick introduction of Paul. Yeah, how do we met? How did we meet?
So we met at the hospital that I'm still working at in Oregon. Someone told me there's this guy named Vincent. He's from the Bay Area, and then that's pretty much all I needed to know. Yeah, because the moment we met, you just click right away, especially when you're from the same area.
Yeah.
So yeah, that was cool.
Yeah, I think I can't remember. We met. So I was probably maybe half a month into working at the telemetry unit where I was native to that unit, and I was like, oh my god, there's who's that Filipino guy? Actually, I didn't even know you were Filipino. I only saw this part. So, and you're
you just knew I'm not white.
I mean, you're who's this brown guy? So we were working night shift on the telemetry floor, and then you were a cool guy. You were always down to help out when I have any questions about any nursing related stuff, because coming as a new grad, I just really didn't know the flow of things or where to find this or what was the policies and procedures. And then we walked out of the hospital into the parking lot, and then I heard your ringtone.
Oh yeah, because we got breakfast afterwards, and then he heard my ringtone, which is Pete Rock and CL Smooth. Mm-hmm. They reminisce over you.
Yeah, I was like, okay, this guy's cool. Right? But I don't want to, steal your thunder. So why don't you introduce yourself and kind of just a brief 2-minute introduction of who you are and what do you do.
Okay. So my name's Paul. I'm from San Jose, and when I got into nursing, I wanted a new grad job in the hospital setting, and being in the Bay Area, I was 99% sure that I had to leave, even if that meant leaving the state, because that's what happened with my sister. Years ago, she went to Texas, then came back. So when I applied for jobs, I still applied in California, just in case, but I applied to states that I also wanted to live in. So primarily Oregon and Washington, and those were all my interviews. I didn't have any in California. And then when I got my job in Oregon, I just picked up and left. Yeah, just because I didn't want to waste time. Oh, maybe I could find a job in California, maybe I can stay, because what ends up happening is the people that have done that, they kill maybe a couple months, maybe a year, and then sometimes they get lucky, sometimes they end up saying, okay, I'm gonna make the move and just go. So I didn't waste time doing that, and now it'll be 2 years next month of being in Oregon.
Oh dang, okay. Congratulations on 2 years. Okay, so we're just gonna get right down into the questions. So what got you into nursing, and what was your education leading up to nursing school?
My mom is a nurse, and I've known that since I was a kid, but as a child growing up, I only knew doctor, businessman, fireman, police officer, just because I was a kid. So I was already saying, oh, I'm going to be a doctor when I grew up, just as default. But then once I got into high school and college, I decided nursing, but I wasn't sure if that was the right choice for me, because I felt unspoken external pressure to be a nurse because I'm Filipino. But then what I realized was one of the things I really love and my primary passion is teaching, and I liked the science classes, and pretty much you do both of those things in nursing. So I felt like I was lucky that those things matched up, because even if I wasn't nursing, I was going to be a teacher or a guidance counselor. And in general, I just love teaching, regardless of if it's not even health related. In 2011, I taught majority of my friends how to drive stick shift, because I just love teaching. So
you should teach me. I don't know how to drive stick shift.
Oh yeah, I'll teach you. So yeah, that's pretty much how I got into nursing. And then when I got into Ohlone College in Newark, did that for 2 years, and then graduated, did the NCLEX, passed, and then just started job hunting.
First of all, shout out to all the Filipino nurses out there. I can definitely attest that Paul is one of the dopest Filipino nurses to work with. Actually, Paul is we kind of make fun, but like you're like my work hubby.
That's what they're saying at work.
Work hubby, or one of my work hubbies, okay? Because I'm in a polyamorous work hubby relationship. Shout out to Sai. He's also another work hubby who's also Filipino too. Oh, Paul, you didn't know Paul? Okay, you didn't know. You definitely have like that teaching persona. I mean, like back in new grad years when I was like asking questions about like TPA or like how to do blood transfusion, or even just like certain medication administration. So Paul definitely has like that teaching credibility. So can definitely see you in an educator role sometime in the future. Mm-hmm. My another question is, and this is kind of like a common trend questions I see in people who are interested in stepping into the profession or who's even interested in just getting into nursing school, is do you think it's necessary to volunteer at a hospital? And if so, like what type of experience do you think someone should have prior to coming into nursing?
I guess like it depends on who you talk to in terms of like getting that volunteer experience, because yes, on paper it looks good because at least like to some degree you get familiar with like certain medical terms, like I guess get a little bit like ahead of the curve in terms of like how to be a nurse, especially in the hospital setting. I haven't done this, but I've heard this from an ER charge nurse and another ER nurse. When people ask that same question, they recommend being a food server, like waiter, waitress. And then the reason being is the flow of it is kind of the same, where you're going to one table to either get their order, drop something off, but then another table asks, oh, can we get more water? Can we get more napkins? Same thing where you're going to another room to, let's say, give medications, but then family member walks out, oh, my family member needs a new blanket, can you get him a blanket? So just that constant minor interruptions, things like that, those things add up, and then you just have to be mindful of what can wait, what should you prioritize, and things like that. So in terms of like the volunteer experience, yeah, like it's helpful for on paper, and then maybe just to hear certain medical terms and kind of like how hospital runs. But if you want to get like, I guess like a good nursing flow, a lot of times people recommend being a waiter or waitress.
Yeah, I can totally see like the hospitality into the nursing profession. I think so much of nursing is patient satisfaction, and I mean, some people will kind of joke and say like, you know, giving somebody a cup of water or giving like a warm blanket is like, there's more to nursing than that, which is entirely true. But I think those little active like services can really lead to a really good patient outcome, right? Like patients will start learning to trust you more when you say you're going to do something, and that just kind of snowball into like an overall better patient care. But totally, like hospitality is definitely, even I think that's a great thing to do even prior to coming to nursing, because I used to work as a barista, right? I used to work in a coffee shop. I think one of my challenges when I started working as a nurse was learning how to multitask. And so, but thankfully, like kind of tapping into like that hospitality experience, it really allows me to kind of learn to focus on each task, and then learning to, number one, like figure out what is the most important thing I need to do now.
Yeah, prioritization,
right? And then just kind of work from there. So, but yeah, like did you had any like clinical experience before you became a nurse? Like were you in the medical profession prior? Were you in the hospitality services before? Like what were you doing before you got into nursing school?
So I think like in terms of medical related experience, I think my first one was, I think it was like roughly 2011 or something. I started like volunteering at the Red Cross. Did that for a couple of years, and then I left that, and then I was volunteering at Kaiser, like in the PACU setting, and then simultaneously doing, I was a respite caregiver for children with autism. So like, not to like diminish what I did, but like the easiest way to explain it was kind of like I was like a caretaker babysitter. So I had 2 children at that time. So I would hang out with the child while the primary caregivers, whether it was like the parents or grandparents, they can get a break. So a lot of times like they would go out, watch a movie, go out for dinner, or just even be on the other side of the house. And I would just hang out with the kid. Like I wasn't doing anything medical related. It was just hanging out.
Gotcha.
And then I was applying for nursing programs, and because it's so impacted in the Bay Area, like I wasn't getting accepted. So in order for me to keep getting some sort of medical experience just to keep getting medical experience, I applied for an EMT program at San Jose City College. And that was only a semester, passed, graduated. And then, so I worked as a BLS EMT for like, I think a year and a half. And then I got into nursing school. So like so that's pretty much all of my like medical experience prior to becoming a nurse.
So you're a float pool nurse, right? Currently, was that your first job as a new grad? Like, were you start off straight as a float pool nurse?
Yeah.
Okay.
So when I applied for my hospital, and I wasn't necessarily picky, I just wanted to apply for a job and then kind of just take whatever they gave me. So when I got the job and they said float pool, I like second guessed it, because I was like, I didn't apply for this. But I wasn't trying to be picky, but then like, because again, I'm a new grad, and then float pool sounded hella intimidating.
Yeah. I mean, it still does for me.
So it was my first job, and it's still like the same job that I have 2 years later. Okay. As a float pool nurse.
Yeah. So like coming from EMT and from some of your other like clinical / volunteer experience, did you feel prepared going into as like a float pool new grad?
It's not that it didn't help me. I would say like at least with the EMT job, I was used to giving and taking report. It still needed work, but then for the most part it was kind of like the same. And then with that experience, it helped me ask certain questions that are like pertinent to the patient. So for example, like when I've dropped off a patient in the ER as an EMT, I think the doctor asked like, oh, when's the last time the patient was dialyzed? Like my grandma has dialysis, but I've just never heard the word dialyzed before.
Oh, okay.
So then that threw me off. And then when I went home, like even my partner didn't even know what that meant. And then when I asked my mom, who's also a nurse, according to her, she said it's like an older term. Usually people ask her when's the last time they had dialysis. So she just said, like when's the last time someone was dialyzed. They're just asking when's the last time they went through dialysis. And also asking what their schedule is, like Monday, Wednesday, Friday, things like that. If you're bringing in a patient with oxygen, you want to ask how much oxygen they're on and is that their baseline.
I see.
Because if someone comes in with 2 liters of oxygen, you want to know, is this what they're on normally? Because like if they have a history of COPD, or if their baseline is room air. So just like kind of getting used to asking those questions as an EMT kind of helped me. But for the most part, it's completely different because you're taking on a new role. Yeah. So it helped to some degree.
Yeah, like what was the training process like for you? Like, were you part of a residency program, or did they just throw you into float pool and then you had like different trainings for different particular units?
Mine was a new grad program. So we had our classroom days where everyone's learning like how to read a telestrip. Everyone's learning like electrolytes. And then when we were training in the clinical setting, the people that were assigned to a specific unit, so like someone like Vincent, he was on the tele unit, his entire training is on that unit. So it was like, I think 8 weeks.
Yeah, it's like, about like 2 months, maybe a little less than that.
Yeah, so it'd be like, and because he was going to be night shift, it was six weeks on days and then 2 weeks on nights. Versus for me, because I'm in float pool, I only had 2 weeks per unit. So I started 2 weeks on the tele unit, and then 2 weeks on the med-surg unit, 2 weeks on the spine ortho unit, and then 2 weeks on our rehab unit, which didn't really count. So it was basically I only got 2 weeks per unit, and then so that was already challenging because, again, you are getting trained on that same unit for 8 weeks. Yeah. And then so in the beginning when I would float to certain units, I'm like, I would just be asking hella questions because I'm familiar to some degree.
Yeah.
And then I was stressed in the beginning because I'm like, why? In general, I was thinking, why would they give a new grad a float pool position? But 2 years later, I'm grateful that I took it because it helps. Yeah, like I see a lot, and then like I do a lot. So at least when I'm on like, let's say the tele unit, I'm familiar with taking care of like a stroke patient, things like that. Just because I go everywhere. And I've seen a lot, so it helped me prepare for almost any patient that you guys or that I take in the hospital.
Yeah, I know there are a couple of people who like watch this YouTube channel, which is like 20 people. Might not even know what float pool nursing is. So, how would you define a float pool nurse? What exactly does that mean? Like, if you were to describe it to a fifth grader.
Oh, okay. So the best way to describe it is there's there's 3 different rooms that we can take care of patients, and each room is for a specific type of patient. So if you come in with a problem with your heart, you would be on the tele unit. If you had a problem with your hip or your knee and you had surgery, you're on the hip and knee unit. If you had a different type of surgery or a different type of medical problem, you're on the med-surg unit. So yeah, just depending on your medical reason for coming to the hospital, that will dictate which room that you stay in. And then as a float pool nurse, I fill in the gaps. So let's say they are one nurse calls in sick on the heart unit, I would go on the heart unit that day. And then the next day, someone calls in sick on the hip unit, I would go to the hip unit. So I just fill in the gaps, which unit needs the most help. So I don't have a home unit. I just go wherever.
Yeah, he's like a vagabond or a nomadic nurse.
Yeah.
He's always constantly like when I used to work with Paul, I'm like, oh Paul, so what unit you're working on? And typically you don't know until like on the arrival, right? Like you get your assignments, like, okay, am I gonna be here today or am I gonna be there today?
Yeah. So because I work on I'm still on night shift. So shift starts at 7 p.m. and then when I wake up around 5 p.m., I'll text the house supervisor, where do I go? And then they'll text me back saying what unit. And then sometimes they don't get back to me until I get to work. And then I just call them, text them again, or find them in person. And they'll say, oh, go to the heart unit, go to the hip unit. Yeah. And I just go.
Do you feel that your assignment tends to be a lot challenging than some other your coworkers? Like, because like the stereotype is like, oh, I don't want to be a float nurse because I always get like the hardest assignments, right? Do you feel that is true for you?
Maybe in the beginning, but then I also wasn't sure if it's like, if I was a seasoned nurse, is this just going to be, is it just because I'm a brand new nurse that I feel that it's challenging? Mm-hmm. There are times that I do feel that way where I'm like, oh, is it because I'm the float nurse? But for the most part, like I always felt like everything was pretty fair with assignments, at least for me. I've definitely heard from other staff members that they felt that when they get floated, that they have like a tougher assignment. But like when that happens, I'm still asking for help. So either you help me or you look like an asshole. Yeah. So like I still ask for help, whether it's from like the CNAs or the nurses. And then I always tell myself like, dude, I'm gonna clock out anyway. So I've definitely had those shifts where they were tough, but I don't necessarily attribute it to it being I got the harder assignment because I'm floating here.
Right.
I just figured, everyone's gonna have a rough shift, so just learn to deal with it.
That's true. Yeah. Share the love, baby. Share the hard assignments and the good assignments. But yeah,
one of the things that was like, I don't attribute this to being in float pool, but at least in California, in the Bay Area, in the hospital that I was doing clinicals at, if one patient was on a telemonitor, your assignment is one nurse to 4 patients.
That's true.
So that's what I was used to.
Yeah.
My very first assignment on my own on the heart unit, all 5 patients were on the heart monitor. And then I asked someone, and I was like, yo, is this legal?
Yeah, this is
and I was like, because in California, they don't do this.
No, they don't, yeah.
And then he was like, yeah, well, you're in Oregon, so.
Yeah. And I guess it's like different facilities too. Like some places where, if you have patients on a drip, right? Typically, you can only have like 3 patients on a drip, right? Because that's considered step down. Mm. But then I know some facilities, you can have up to 4 patients on a drip.
Yeah.
So you're just...
Depending on your facility, your state,
right.
Things like that.
Yeah. But no, that's true. Yeah, California, we do have up to 4 patients on telemetry. But I know in Oregon it was like 5.
Yeah,
right.
it was also different on nights because I think on days they'll have 4, I think, and then it may be occasionally 5. But on nights, like you can go up to 5 patients.
Go up to 5, yeah.
And then on the med surg unit, they could go up to 6.
Whew, yeah. Shout out to the night shift nurse because I was there and it was brutal. It was hard stuff. Things can just change in an instant. So, kind of want to talk about like the pros and cons. So, what would you say is? Let's just start with the negatives, okay?
Okay.
What do you think personally is the cons of working as a float pool nurse?
I would say in general, the cons would be if you don't have a home unit, sometimes you could get not that it would be hard to get help. It would kind of getting used to which coworkers can you turn to for help, because like you're still gonna get those coworkers that love to help and then are down, and then others where it's like, okay, they're probably not gonna be like the most helpful or approachable. But then I feel at my hospital, because one, they're either hella friendly, or it's also because it's a small hospital that everyone is extremely nice and like always down to help.
Yeah.
So that's what I like. But I would say in general, that would be the con.
Yeah.
And then also because as a float nurse, when you don't get the same type of patient a lot, you're not as familiar with the proper, or how to, like, I guess like the proper steps on like taking care of them.
Yeah.
Because like, so for example, if a patient has a continuous bladder irrigation, that is a med-surg thing. But if the patient has something wrong with their heart where they need to be on a cardiac drip, they would have to be transferred to the tele unit because we have to monitor their heart.
Right, yeah.
But then like, we still have to manage the continuous bladder irrigation, or the CBI for short. So then that's when it's like, even if you weren't a float nurse, like that's still gonna be challenging because you're taking care of a med-surg patient with a heart problem.
Yeah.
The heart problem, like the tele unit could take care of, but like not everyone's familiar with the CBI. And then that would be the same thing for me, where I'm familiar with what a CBI is and how it should be run, but if I don't physically take care of that patient, like I can watch all the YouTube videos, but it's different when you actually have like the hands-on experience.
Right, yeah.
So that would be the con, because if I don't see that type of patient all the time, I would still have to constantly ask for help. Like, how do you do this?
Right.
And like, that was like one of the, I guess, like annoying things that I heard as a float nurse. They're like, oh yeah, you float to the med-surg unit, like you know how to take care of this patient. I'm like,
you should be a pro at starting floats.
Right? I'm just like, dude, barely. Yeah, like again, because I'm a float nurse, I see a lot of things, but I also don't see a lot of things, because it's like, if I'm not always on the heart unit, I'm not always gonna see, the things that they do because I'm on a different unit.
Right.
Things like that.
Yeah, you're basically like a jack of all trades, essentially.
Yeah.
Yeah. I mean, even when I was working on one unit, right, as a new grad at the time, there's a lot of things that I haven't done a lot too. Like, I think CBI was one of them, because I mean, not often do we get CBI patients on the telemetry floor.
Exactly.
But sometimes I'll just pull up my policy and procedures, and I'll just pull up like a YouTube video, and like I'll just watch it, and then 10 minutes prior to that, I'll go in, okay, let's do this. The patient was fine, but like.
And we still call the med-surg unit, hey, can you guys come over to run it over with us? And like, they're super great about that.
Right.
And they help us out, so.
Yeah, always know which resources to pull through when you have questions. But yeah, I can totally understand, like when you're a float pool nurse, like one of the challenges is to find that gang of nurses that you have developed like rapport with.
Yeah.
And it's challenging if like you're only on that unit maybe once a week, and you don't know what their working schedule is like too. So that could be a definitely challenging thing. But kind of moving on to the positive side. So what would you say is the pros of being a float pool nurse?
So yeah, the pros would be that you are familiar with a lot of things. So again, like let's say I spent like 5 months on the med-surg unit and I'm familiar with the CBIs, and then I'm working on the heart unit for that day, and the patient with the CBI comes over because they have an issue with their heart, I would feel comfortable taking that patient compared to the other tele nurses, because I've floated to the med-surg unit a lot. I'm familiar with how to do the CBIs. So like, there are certain things that I'm like comfortable with. So like, I've spent a lot of time on the tele unit, so I'm okay with like stroke patients, like doing the NIH, I'm okay with doing like the alcohol withdrawal scale, the CWA.
Mm-hmm.
I floated to the ER, so like I'm more comfortable with doing IVs.
Yeah.
And yeah. So again, like because I've seen a lot, like I'm like comfortable with like seeing and doing a lot of things where like I'm not as like intimidated floating to a different unit because like okay, like I'm familiar with how these like what happens after this patient's surgery,
Right.
what to like look out for and things like that.
Right. Yeah. So okay, so you work at the ED. You worked at telemetry. You work at med surg. You work on orthopedic. You work in rehab. You also work at ICU. Is there any particular unit that you enjoy the most, and any particular unit that you find the most challenging, or you prefer to work in a different unit when you're there?
As of now, I don't necessarily have a favorite patient population, but I do find myself always wanting to float to the tele unit.
Yeah.
Just because like I hella get along with the CNAs and the RNs over there, and yeah, I don't know why. Like it's the people there that I like working with the most.
Right.
So
Yeah.
I always want to float there, not necessarily like the type of patients you guys get.
Yeah.
Because I'm tired of doing the strokes. I'm tired of doing that. But yeah, like that's the one I like going to the most. I like floating to the ER because it's faster paced. See a patient for a couple hours, they either get admitted or they're discharged. So like I like that motion. Don't necessarily like ICU. Like I learned a lot there, and I'm not taking like the crazy ICU patients. Like they'll give me a lighter assignment because they understand I'm a float nurse, and they have to prioritize patient safety. So even though there was like that one fear of when people float that they're gonna get the worst assignment, like they're not gonna do that in the ICU setting because patient safety.
Yeah. Set up the failure.
But yeah, I've noticed like ICU wasn't necessarily for me. Like they're hella smart there. They do a lot, and you have to be like very knowledgeable in like your drips and things like that. I just realized it's not like for me. Like the times I floated there and then I'm helping someone like turn a patient and then I see them on like 10 drips. I'm like, why do you want to do this? It's not appealing to me. So
Yeah. Okay, cool. So we're gonna change up the pace a little bit. So this question is, what was it like, or what is it like working as a nurse in a female dominant profession?
oh, I never like, at least me personally, I never think anything of it. Like I guess because it's female dominated, when I see other male nurses, like yeah, it's cool.
Yeah.
But it doesn't, like I never really thought anything of it. Like it's same thing with like I don't know, ever since elementary school, majority I think all of my majority of my teachers from elementary to college have been female, and I just like I don't think anything of it. Like I don't think women act this way versus men act this way and stuff. Like I'm just there to work. Yeah, like I just never think anything of it.
Yeah.
Everyone's super nice and helpful, and like that's pretty much all I care about at the end of the day.
Yeah.
So yeah, like, and I guess like that's another thing about being float nurse. Regardless of like with the unit I'm on, like I don't pay attention to like the gossip.
Yeah.
Whether like nurses, CNAs, male, female, like none of my business.
We ain't got time for that.
I got time for that.
No, I mean for me it's like,
Yeah, how's it for you?
Well, for me I mean, besides the gossip, I mean guys gossip too all the time too, but like for me it's like I'm always calling for help for like helping to pull up a patient or turning them, things of that sort. So just more of like the physical part.
Oh yeah.
Other than that, I mean like it's nothing new to me. It's nothing new to you. It's nothing new to like a lot of nurses who are male. I mean, once you get past the nursing school, like that culture shock is like gone. Right?
Oh yeah.
It's like you're in a school full of a lot of women, so it's like no big deal working at a hospital.
I think it would throw me off if I see almost all men on a unit, because like that's not what I'm used to. So then it's just like it's more of like there's a lot of guys like tonight, but like that's pretty much it.
Right. I think the only thing that stood out to me is patient interaction. Sometimes a patient would call me doc multiple times, and I have to remind them I'm not a doctor, to a point where I just stopped reminding them.
Oh yeah.
But be like, oh hey doctor, or like they're on the phone like, hey, doctor's coming in right now.
Oh yeah, I hear that a lot.
Yeah, I'm like, no, I'm a nurse. Just call me nurse B. And then be like, no, but she's your doctor. She's coming in right now. So just little things like that. But the work has been the same. There's no issues with that. But yeah, kind of switching up to another question, which is kind of similar to the last question, but and this is the last question. Last question. Or second to last. Okay. So what is it like working as a person of color nurse in a female dominant profession in a white dominant city?
Yo, so like when I when I first moved to Oregon, like I looked up my city's demographic. You could probably pull it up right now. I think it's like 99% white, 0.02% like Asian, things like that. So when I first moved to the city, I was pretty nervous because I wasn't sure like, oh, how are people gonna treat me? Are people gonna look at me funny? But at least in my experience, I got over that within like a week. Like when I go to the grocery store, I found myself always like looking around, but no one's looking at me. And it wasn't until I think a year and a half when I had my first like racist patient. Like, can I say what they said? Or it's like nothing bad.
Yeah.
Like
but it stood out to you.
It stood out to me. Like she didn't call me a slur, but so she came in with chest pain, and then when patients come in with chest pain, we have to do an EKG on them. So they have to take off their shirt, and then we put stickers on their chest, and then we put wires on to take a picture of their heart. And then because they were gonna undress her, I just stepped out so they could put the stickers on. I went back in the room to start an IV. Unfortunately, I didn't get it. When I stepped out, a female nurse that was in there with the patient, and then she was like, oh yeah, I'm glad he stepped out for the EKG because I didn't want Julio looking at my boobs. The nurse called her out, and she was like, you know, Paul's a great nurse, don't make those type of comments,
sure.
which I hell appreciate.
Yeah.
So when she told me, it was just like, first of all, I'm pretty sure I introduced myself as Paul. Second, I'm not even Hispanic, I'm Asian. So yeah, that like stood out to me. But yeah, like surprisingly, I do get asked about my ethnicity like a little bit, but the question I actually get asked the most is my age. And whenever a patient has asked me, I always ask them like, what about me makes it seem like I'm young? Because we're in a pandemic, so we're all wearing masks, face shields, things like that. So you can only see my eyes. And then that's pretty much like the question, or how they answer my question is like, oh, it's your eyes, like you look young. And then I don't get offended by it because, I mean, I look young.
Yeah.
But yeah, like
I still get carded all the time.
I still get carded. But yeah, like a lot of the times the patients don't necessarily like ask about my ethnicity.
Yeah.
I've got like people have asked if I was Indian. Like one patient, when you ask someone where they from, they could tell if you're asking, oh, are you from Oregon? Are you from the area? Or if you're from this country.
Yeah.
Depending on how they ask.
Right.
So like when I got that question, he asked like, oh, so like where are you from? I knew what he meant.
Yeah.
I still said California. Because
so now where you really from?
Because it's true. And he says, oh, where's your parents from? So then I said the Philippines, and then he was like, oh, not India? I was like, no.
And then you got to give like a history,
Yeah.
like education, all that.
And then one patient straight up asked like, what kind of Indian are you?
I was like, dang.
Not even subtle about it. But like, going back to your question, like, surprisingly, I don't get that question asked a lot, but like, I'm prepared to, but it doesn't really bother me.
Yeah. Kind of pulling up the demographics right now. I'm not going to say the city, but it is 88% white.
88.
1.5% Asian and 0.5% Pacific Islander.
Yeah.
Yeah.
So compare that to like San Jose, I think is like 33% Asian.
Right. Yeah.
Like the Bay Area in general.
Big time. Yeah. But I mean, when I was working there, like honestly, I saw a lot of Asians working in the hospital than I did seeing Asians on the streets.
Oh no, yeah.
So like, I never felt alienated. You know, I felt like I found my community there too. And you know, when you're nurses, when you're working with like a diverse group, you know, like it's really cool that you had an experience where nurses stood up for you, where they knew that was not okay. And you know, that makes the dream team. Is like everyone's just supporting each other in this crazy pandemic. And just last question, I kind of want to just get back into the theme of float pool. So you share your experience about working in float pool, you share some of the pros and cons. What do you think, if someone is interested in float pool, what should they consider before coming into as a float pool nurse?
Yeah, I would say just like be prepared to ask a lot of questions. Be prepared just to get the quote unquote tougher assignments. But again, you're going to make yourself a stronger nurse. And, you know, if you're trying to escape like hospital politics, that's great too. But yeah, just be prepared to ask a lot of questions. You know, just know that you're going to get a wide variety of patients. But again, like that'll help you out in the future, you know, regardless of what you're trying to do with your career.
Well said. Well, thank you, Paul, for taking part of the very first Q&A.
Yeah, thanks for having me.
Yeah, I think you probably hear this all the time. It's gonna sound cliche, but thank you for doing what you do. No, I mean, like, you know, right now I'm not working at bedside, but you know, sometime in the near future I hope to. But you know, definitely thank you for sticking out there for the community that you serve. I know it's definitely not easy, but you know, seeing you thriving and doing your best is very inspiring. So we appreciate you. We appreciate all the nurses out there, everyone who's working at bedside for, you know, taking care of people who are sick. So that is all. And if you like this video, oh my God, I want to say it. Hit the like button and subscribe and share it to your friends for those who are interested in getting into nursing or those who are interested in just learning about what it's like to be in Paul's shoes. Until next time, peace.
Ask about my skincare routine.
Ask about my skincare routine. And ask about Maple's skincare routine.
Hi, Maple.
She was there the whole time. All right, take it easy, take care of each other, and it's flu season. Get your shot on. Goodbye.